The following is an article from Health Magazine, Fall 2024 edition, published by the Southwest Utah Public Health Foundation.
This is a recording of the article In the Balance, Body Weight and Your Health by David W. Blodgett, MD, MPH. In previous issues of Health Magazine, we introduced the concept that there are certain health practices that result in big differences for long-term health. If you take what we've called the Big Four and consistently implement them in your life, you're 70% less likely to develop chronic diseases or die early. The Big Four are: eat enough fruits and vegetables, exercise, maintain a healthy weight, and don't smoke. We've also recently emphasized two additional factors that significantly impact health outcomes: adequate sleep and avoiding alcohol consumption. There are countless options about best health practices, and many have some truth to them, but the Big Four consistently rise to the top as the leading contributors to a longer and healthier life. In the field of public health, we study the diseases responsible for the most deaths: heart disease, cancer, and stroke, as well as the underlying factors that lead to those deaths, such as cigarette smoking, inactivity, poor diet, and alcohol consumption. In our modern marketing and data-drenched society, it can be difficult to sort through the noise to identify the most critical components of health improvement, the most important over the sensational. My hope is to persuade you to return to the basics of living a healthy lifestyle, what we sometimes call the things that your mother taught you. Ironically, with all the health-focused information available, very few of us have mastered the Big Four. Less than 6% of adults in the United States, in fact. So there is plenty of improvement to be made. This article will address the final topic we haven't covered yet from the Big Four: maintaining a healthy weight. The statistics about being overweight in the United States and the world have been concerning. A few years ago, it looked like the increasing weight trend might have topped out, but the COVID years seem to have extended it, and the latest data shows we are still headed in the wrong direction. Today, about 40% of American adults are obese, and another 30% are overweight. The trend is also alarming in children, where obesity rates are 12.7% among 2 to 5-year-olds, 20.7% of 6 to 11-year-olds, and 22.2% of 12 to 19-year-olds. This represents a doubling of obesity rates in children since 1990. These trends are worth paying attention to because being overweight is a significant predictor of chronic disease and early death. Often it is found alongside higher blood pressure, higher blood sugars, and higher cholesterol levels, which are all indicators of chronic disease to come. The Centers for Disease Control note that being overweight has been linked to the following list of diseases and health risks: high blood pressure, high cholesterol, type 2 diabetes, heart disease, stroke, gallbladder disease, osteoarthritis, sleep apnea, and breathing problems, many types of cancer, lower quality of life, mental illness, such as clinical depression and anxiety, body pain, difficulty with physical functioning, and early death. There are several ways to find out where you fall in the weight spectrum. Many healthcare providers use body mass index or BMI as a screening tool to identify health risks based on the relationship between your height and weight. Another way to monitor healthy weight is to focus on abdominal body fat, which is an important indicator of the impact extra weight will have on your health. This is done by measuring belly circumference at the navel. A measurement of 40 plus inches in men or 35 plus inches in women is an indicator of obesity. You can also use the waist to hip ratio. Here's the good news. Studies show that there are significant benefits from even modest weight loss. So having a perfect BMI shouldn't be the goal for people who are overweight. Losing 5 to 10% of their body weight has been shown to dramatically improve long-term health outcomes. If you are obese and have prediabetes, losing 7% of your body weight results in a 68% reduction in the risk of developing actual diabetes. As another example, every pound of weight you lose results in 4 less pounds of stress on your knees when you walk. Weight loss seems to be where our Big Four indicators come together. Eating 5 1-cup servings of fruits and vegetables daily and exercising for at least 150 minutes a week will reduce excess weight and maintain a balance once we get there. It is important not to think of weight loss as a fast 1-week process. Many of the people I have known who were the most successful at losing and keeping off weight used a gradual approach. It works best to lose 1 or 2 pounds a week so your body doesn't react as if it were starving. Most Americans gain about 1 pound a year through their adult lives, so perhaps the best place to start is to make adjustments in diet and exercise as our calorie needs decrease with age. Another principle I have found to be true is this: don't drink your calories. If you are trying to stay within your recommended calories per day, 200 calories from a soda puts a big dent in your allowance with no nutritional value, going into fat storage while leaving your body wanting more. Finally, the foods you have in the house will be the foods you'll eat. You can beat temptation by keeping your home free of junk food in the first place, replacing it with healthy food and snacks that you and your family enjoy eating. I am convinced that most of you reading this can easily begin to do a little better in at least one of the big four healthy behaviors. Improving in even one area will make it easier to improve in the others. Feeling better and living a longer, healthier life will be worth it.
If this episode kept you alert and informed, mission accomplished.